Before the pandemic, the National Advisory Committee on Immunization was a little-known group of scientists giving the government advice. But the COVID-19 pandemic thrust it very much into the spotlight, and it eventually came under scrutiny over its mixed messaging. Dr. Caroline Quach-Thanh finished up her 4-year term as chair of the group yesterday. She's in Montreal. Dr. Quach-Thanh, welcome back to Power and Politics. You're done.
Thank you. I'm done.
How's that feel?
Well, there's the pressure off my shoulders. There's a little pinch also to say that I'm leaving a great committee that had to take very difficult decisions. But, there's a feeling of work well done. I'm happy with what happened.
This was not work that you could have predicted, to the extent that when you started your 4-year term, you didn't know there was going to be a pandemic to finish out that term. What do you make of the experience?
Well, I think that I learned a lot. I was surrounded by brilliant people who all worked very hard. The NACI Secretariat within the Public Health Agency of Canada was also very supportive. I never thought, in fact, when the pandemic hit, I even thought that I might end my term without having to deal with vaccines, but in the end, vaccines actually came much quicker than expected, which is great. And, had to learn how to deal with complicated political asks while remaining transparent and science-based and taking into account what would be best for Canadians, and, having to face the criticisms that at times came.
Let's talk about some of that criticism, because it often circulated around confusion and of changing advice. So first AstraZeneca for this age, and then for this age, and then take the first vaccine you can get, and then, well, the mRNAs are preferential. What do you think you learned sort of in the heat of the fire about communication?
Well, I think it's very complicated to communicate clearly when science is moving by the minute. It's not even, 2 weeks' time. It's from day to day. You had a new publication that was coming out, and you never knew ahead of time what was coming ahead. And so you're trying to navigate saying, I think this is going to come out, but in a month time, and by all means, it comes out the next day. And so you have to face that. I also think that having Health Canada make authorization on a product with people not understanding the difference between authorization and a recommendation from a public health advisory panel to the government. So that there might be discrepancies, that there were discrepancies before, and that there will still be moving forward. I think that was something that needed to be communicated.
But that's a challenge for people to hear. I mean, I think people crave consistent, singular messaging so they know what to do.
I agree, but we're not looking at the data through the same lens. And so we can't really do it any differently than to say, Health Canada will look at that vaccine in a silo and say, with the randomized controlled trial data we have, it is efficacious, it is immunogenic, it is safe, and that's perfect. Once they do that, then we have at NACI to take it and look at it in a larger context. What's coming to Canada? How could we deploy the program so that it protects Canadians as best we can? And of course, it would be much easier and less painful to just say, let's go with the authorized indication and how it's been approved. However, at times, it might not be the best decision for the country. And I fully understand the difficulty it was to understand that and even to communicate it. We did our best. We were transparent. And I think, in the end, at this point in time, at least, I think for most of the things, we were not wrong.
So you're off of NACI now. That part is done. You have perhaps more freedom to speak now. And I wonder what you would tell Canadians who are either have that second shot in their arm or are imminently going to get it, what they should expect once they are fully vaccinated.
Well, that I think, so from what we know in terms of vaccine effectiveness, we see that 2 doses are actually quite good in terms of prevention against even the Delta variant, which is the variant that first was identified in India, with 2 doses of AstraZeneca having a 60% effectiveness and 2 doses of Pfizer in the UK having over 80% effectiveness. So that I think is quite reassuring. I expect that eventually people who have had their 2 doses will be able to remove a lot of the measures that we've put in place. So masking will eventually go. I think quarantine should go. The only, I think, element that is not completely attached with my protection is that because it's not 100% effective, I also need, before I let go of all those barriers and preventive measures, that people around me are also protected so that there's not a new spread in the community. So we're at the point where we're, balancing between we're getting more and more people with 2 doses in their arms, but we want a certain proportion of them to have it before we let go of the measures, because how can you tell if I walk into your store if I had my 2 doses of vaccine or not?
Yeah.
It would be very easy if with that second dose my ears start flashing pink, but that's not the case. And so not being able to easily identify who had their 2 doses, the only way out at a populational level is to say, we know that in that area, over 80% of people were vaccinated, and therefore, even if there was, like something that happened, a case that occurred, we would have enough protection in the community so that spread would not be such a big deal.
Dr. Quach-Thanh, thank you so much for your time. Back to your previous life, your regular medical life now. Thank you and good luck.
Thank you very much. Have a good evening.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.